Thank you for choosing Sharp Home Infusion Services for your home IV therapy needs. Please follow these steps to safely administer your IV therapy at home. You will be using a CADD Solus infusion pump to deliver your medication at the correct dose and controlled rate. CADD stands for Continuous Ambulatory Delivery Device. This video will show you how to change the medication bag and tubing that works with your CADD Solus pump. You will need to change the tubing every 48 hours, which is every other day. To keep the infusion system clean and working properly, you must follow the procedures demonstrated in this video. Before you begin, first wash your hands and prepare your work area as shown in video 1. You will need the following supplies: a new IV medication bag as prescribed. Be sure to remove the IV bag from the refrigerator 30 minutes before to allow it to come to room temperature. An alcohol prep pad or wipe, 1 sodium chloride pre-filled syringe, and a new set of tubing. Before changing the tubing, it's important to check your medication. Inspect your bag for the presence of any cloudiness, particles, or change in color. Gently squeeze the medication bag to detect any leaks. Check the label to make sure it has your name, shows the correct drug and dose, and is not expired. If you have any issues or questions about your supplies, please call your nursing agency or pharmacist before proceeding. Now remove the new tubing from its packaging and the tab from the entry port of the new medication bag. Remove the cap from the spike on the new tubing. Do not touch the tubing spike to any non-sterile areas. Spike the new entry port of the new bag with the pump tubing. Press the Start/Stop key on the pump. The pump screen will display Stop the pump. Press the Yes key. Close the tubing clamps and disconnect the used tubing from the injection valve on your vascular access device. Now remove the used cassette and tubing from the pump by pulling down on the latch. Remove the blue anti-free flow device on the new tubing cassette. Attach the new tubing cassette to the pump. You should hear a clicking sound when it is seated properly. Push up on the latch to lock the cassette in place. When the pump screen displays Reset Reservoir Volume 2, press the Yes key. If the screen does not display Reset Reservoir Volume 2, you may press the Task key and highlight Reset Reservoir Volume. Press the Select key to confirm. When the pump screen displays Prime Tubing, press the Yes key. Press the Prime key. When the tubing has been fully primed and there's no air present in the tubing, press the Stop Priming key. Press the No key when the pump displays Continue Priming. Clean the injection valve on your vascular access device with an alcohol wipe for 15 seconds. Remove the air from your pre-filled normal saline syringe and attach it to your injection valve. Open any closed clamps and inject 10 milliliters using the pulse flush technique. Remove the syringe and discard it properly. Clean the injection valve with alcohol for 15 seconds and attach the pump tubing to your injection valve. The pump screen will display Start Pump. When you see this, press the Yes key. When the pump is running properly, the green light at the top left side of the pump will blink and the word Running will be displayed at the top of the screen. To extend battery life, the pump may go into a screensaver mode and the pump screen may turn black. Press any white key to bring the screen back into view. Now your infusion therapy is running properly with your new tubing. We hope you found these instructions helpful. Thank you again for choosing Sharp Home Infusion Services.